All right, now we're going to look into knee pain. So if you go to our website, you'll see underneath common conditions, knee pain. Now, knee pain is a very common symptom that people normally present to in the clinic. And from the many causes of various knee pain, there are two conditions that we see quite a lot at the clinic. The first of those conditions is what we refer to as patella femoral pain syndrome. And generally it is a broad term used to describe pain in the front of the actual knee. So also known as runner's knee or jumper's knee. Patients normally come in to the clinic complaining of pain, normally what we call diffuse, so spread out around the patella of the actual knee. And normally symptoms will be walking uphill or upstairs, anything that sort of flexes and puts pressure around the muscles of the actual knee, and they would have this pain around the patella bone. Now, the actual cause of this type of pain, it's sort of what we call multifactorial, meaning it can be caused by a variety of different things, either one of those things or a couple of those things sort of all together or at once. So a lot of times what we look at when a patient presents with these type of conditions is we try to isolate what the problem is. So look here, for example, we've got is a common with people that participate in sport, adults, youth, it happens to everyone, and the most common is knee pain, which increases when stair climbing or squatting movements. And so a lot of time when patients present with these actual problems, we try to analyze and find what the cause is. Now, a lot of times what we find is pronation, or the feet rolling in, changes the tracking of what we call the patella bone, which is the bone at the front of the knee, which causes that type of pain to develop. But generally we have to assess the patient to see there what we call the knee alignment. Another alignment that we look at is Q angle, which is the alignment of the actual knee, so Q angle of the knee. So if they're normal, knock-kneed or bow-legged, or how much deviation there is of the actual knee, and do they fall within normal limits. Another important aspect which generally I found is looking to see the patella, so the patella bone at the front of the knee, to check its tracking, to see which way is it moving, more towards the lateral side or the inside, and how that relates to foot position. So normally patients are put through what we call a biomechanical assessment, which we try to assess the actual knee. Now, the treatments can include strapping of the actual knee, and if we find that there is a biomechanical issue of the foot which relates to this actual knee problem, then we can also recommend orthotics. So that's a very common knee problem that we see on a regular basis at the clinic. Now, another type of knee pain that we see, and there are many others, there's ACL injuries, collateral ligament injuries, and so forth, but these are the two common. So one of them is patella femoral pain syndrome, or PFPS. Some people call it a disease, a disorder, but pain that's characterized at the front of the actual knee, just like this photo, generally diffuse, meaning they can't pinpoint exactly where it is, but it's sort of within that area. The other type of condition that we see a lot at the clinic is related to knee osteoarthritis, which is a degeneration of the knee joint. All right, so it's a disease of the knee joint, and it is a result of wear and tear, where you start to lose the cartilage of the actual knee. And it's common. We don't normally see this in young people, only if it's related to injury, but it's common in the elderly. And generally with knee osteoarthritis, we find that there are two, what I mean by two types, meaning two positional types. So yes, there's stage 1, stage 2, stage 3, stage 4, as we can see here. Some people are adding the stage 5, where there's narrowing, and eventually there's bone on bone. But a lot of times the wearing happens on either the medial side of the knee or the lateral side of the knee, and this is where podiatry comes in. Okay, so this is a classification of 0 to 4 grade, which is pretty much 5 grades. But you can see with this patient here that the narrowing is on the inside. So here we still see a gap, right? the narrowing and the joint narrowing is on the inside. Now, if we look at the foot position, right, with foot posture, so we'll just type in foot posture so we can get a little bit more information. In regards to foot posture, when the foot rolls in, it rotates the position of the actual knee. So it displaces the pressure or moves the pressure away. So if someone is having osteoarthritis pain on the inside of the actual knee, we can actually shift that pressure towards the outside. Like when someone has osteoarthritis on the outside of the knee, we can shift the pressure on the inside by correcting the position of the actual foot. Okay, or what we sometimes say is a little bit of overcorrection to take pressure off the actual knee. Now, it doesn't stop the osteoarthritis. If anything, it may wear out a little bit on the other side, but if someone, for example, is trying to buy time, they need a full knee replacement, they're not ready to have one now, and they want to try to delay the surgery, then this is an option. Now, this is just a research article, assessment of foot posture and related factors in patients with knee osteoarthritis. This is just a study. The aim of the study was to compare foot posture between patients and control groups and to identify factors associated with foot posture abnormalities in knee osteoarthritis. So I don't want to get too much into the detail, but if we look into the conclusion, all right, joint hypermobility and foot posture are the factors which may influence the clinical characteristics of knee osteoarthritis, meaning that the flexibility of the joint, meaning the foot or the knee, most likely is probably referring to the knee flexibility, but also the foot flexibility, because when the foot moves, the knee moves. And foot posture, so the position of the foot, if the foot is rolling in too much or the foot is rolling out too much. They are factors which may influence the clinical characteristics, meaning the outcomes. What's happening with this knee osteoarthritis? Is it wearing on the inside? Is it wearing on the outside? How much is wearing? Foot posture and joint hypermobility should be taken into consideration during the examination and management of patients with osteoarthritis. So this is what podiatrists do. We take the foot posture and the joint hypermobility. So we do assess the actual knee, the flexion and the hypermobility, extension and so forth. And the range of motion of the knee, and we relate that back to the foot posture, and we see how we can reduce the disease. So if we're looking, therefore, a biomechanical approach should be included in the treatment plan for patients with knee osteoarthritis to increase patient functionality and possibly reduce the disease progression. So definitely we can reduce it if it's related to foot posture. But unfortunately it is a wear and tear, so it will eventually move or through its stages of degeneration. But definitely if someone is suffering from knee osteoarthritis, then yes, they can book in, make an appointment, we can assess the situation. This is just a little bit more information. So generally, in conclusion, patients with knee osteoarthritis are prone to supinate and pronate the foot. Okay, so their foot position is either going one way or the other too much, which coincides with either wearing out the inside or the outside of the actual knee. In this study, the clinical parameters were found to be significantly different among the foot posture groups of patients with knee osteoarthritis. The high score was found to be in supinated feet. And this is something that we've always realized, that people that have supinated feet generally have more problems with their knee. Supination means feet that roll out the other way. So foot posture should be clinically evaluated with simple tools as what we call foot posture index, but that's just a method of assessment. Okay, these results can provide treatments and opinions of management for osteoarthritis as footwear interventions and orthoses, which are orthotics, may be beneficial with the effect of realigning or fixing the foot posture in appropriate patients. So this is something very, very important, that yes, we can use orthotics to alleviate the pressures of the actual knee when it comes to knee osteoarthritis, and same with what we mentioned with patella femoral pain syndrome.